Even though there are 8 offices that address the importance of women's health, there is currently no office to address men's health at the federal level. The establishment of an Office of Men's Health through the U.S. Department of Health and Human Services would help address critical men's health concerns. It would also create policies that would have a positive impact on public health outcomes that impact men and boys. Men's health issues include prostate cancer, mental health awareness, the gender lifespan gap, and health disparities that affect different demographics of men. Establishing a national office of men's health would help address these health issues and would help conduct more research on men's health. The offices that address women's and children's health have made great successes in distributing health resources, making policy changes, and advocacy. With the successes of the Women's Offices of Health, an Office of Men's Health would be a large step forward in accomplishing the goals of the Men's Health Network. Men are not as comfortable talking about their health as women are. This is because men's health is a stigmatized subject that is not addressed by the media or the federal government. The purpose of an Office of Men's Health would be to address men's health on a national level. Studies have shown that men do not feel welcomed in healthcare facilities because they feel like their concerns are not prioritized. The graphics and information available in most doctors' offices and emergency rooms are catered towards women and children. This reinforces the idea that men's health is not important. The lack of a national office of men's health in the Department of Health and Human Services also contributes to this idea as well. The gender lifespan gap is a growing public health issue in the United States. On average, men live 6 years less than women. There is a dire need for the establishment of a national office of men's health to address issues such as the gender lifespan gap. Heart disease is the leading cause of death for men in the United States. It is important for men to be aware of this information and know how to prevent this. Knowing your blood pressure, talking to a healthcare provider, checking cholesterol, and making healthier life choices are all ways that men can limit the risks of heart disease. The second leading cause of death for men in the United States is prostate cancer. Since 2014, the rate of being diagnosed with prostate cancer has increased by 4%. This means about 1 in 8 men will be diagnosed with prostate cancer in their life. The risk of prostate cancer can vary for men based on their age or race and ethnicity. These statistics are alarming, which is why Men's Health Network believes in working towards ways to help decrease deaths and diagnosis rates. We believe establishing an Office of Men's Health within the Department of Health and Human Services would educate the public more about men's health issues and prevent them from increasing. The Office of Women's Health within the Department of Health and Human Services was established in 1991 and has since helped the development of many women's health initiatives. In 1998, the Department of Health and Human Services launched the National Women's Health Information Center. This provides reliable and accurate information about women's health. The Office of Women's Health has also developed guidelines to include women and minorities in clinical research. All of these accomplishments have improved the health of women and girls across the United States and have addressed serious public health concerns. Some policies that the Office of Women's Health has helped implement is the 21st Century Cures Act and Executive Order 14120, Advancing Women's Health Research and Innovation. By looking at the successes of the Office of Women's Health, it can be concluded that establishing an Office of Men's Health would have similar outcomes for men. There is a need for the federal government to address men's health in the same way that women's health is addressed to improve the life of men and boys. The Men's Health Awareness and Improvement Act was introduced on June 15, 2023 by Representative Donald Payne of New Jersey's 10th District. Men's Health Network worked diligently to help introduce this bill to Congress in hopes that it would pass. This bill calls for the creation of an Office of Men's Health within the Department of Health and Human Services. It also highlights public health concerns for men like the gender lifespan gap and high suicide rates. The Men's Health Awareness and Improvement Act also required that government research be done about why men underutilize health services and how to resolve this issue. It is unfortunate that this bill was not passed because it would have been a landmark moment for men's health. Despite this loss, Men's Health Network continues to advocate for the establishment of a National Office of Men's Health by working with lawmakers and creating educational resources. Even though the proposed legislation for establishing an Office of Men's Health was not passed, Men's Health Network has not given up on this initiative. We continue to meet with policymakers, nonprofit leaders, and public health professionals to advocate for this cause. By making men's health issues a widely known topic and educating the public, we hope that more people will start to realize that men's health concerns impact all people. Our goal is not to diminish the importance or take away resources from women's health research, but to give the same resources to men. Men's Health Network attends community events and creates partnerships with local and federal organizations to advocate for creating an Office of Men's Health. Fostering more partnerships and providing educational resources for the public is a major way that we aim to get support for a national Office of Men's Health. Starting the conversation about men's health issues such as prostate cancer, the gender lifespan gap, and male suicide is the hardest part. Normalizing these discussions will help lawmakers and other citizens to recognize the need for an Office of Men's Health. Through this video, I hope we now share the opinion of the importance of an Office of Men's Health. The Office of Women's Health has made great accomplishments in research, policymaking, and education about health issues for women. Establishing the same thing for men would help improve the lives of men across the United States.